We are moving in the right direction. The data shows that we are moving in the right direction as a nation. As we reopen, the basic public health recommendations we've emphasized remain important. We've flattened the curve, but that doesn't mean that COVID has gone away, that it's any less contagious, that it's any less deadly to vulnerable communities.
All right, that's U.S. Surgeon General Jerome Adams with that warning yesterday about the coronavirus. And it's playing out in Texas, where Houston area officials announced yesterday that they are preparing to reimpose stay-at-home orders and reopen a COVID-19 hospital at a football stadium after the Lone Star State recorded its highest one-day tally of new cases since the pandemic emerged. Harris County Judge Lina Hidalgo yesterday said in part, quote, "We may be approaching the precipice of a disaster. It's out of our hands right now. The good news is it's not severe out of hand." Any plan to reinstate local lockdowns, however, may hold little legal authority after Governor Greg Abbott issued executive orders to reopen the state that superseded county and municipal directives. Joining us now, Morning Joe Chief Medical Correspondent Dr. Dave Campbell and Dr. Vin Gupta. He's a pulmonologist who has treated critically ill coronavirus patients in Washington state. He's also an NBC News medical contributor. Dr. Dave, I'll start with you. There are public health experts who are openly worrying about a second wave. What are you hearing, and how big is it going to be compared to the first wave?
You know, Mika, it's not even a second wave. Now we're starting to hear that the first wave never went away, and almost half the states in this country are seeing spikes. The last count I saw was 21 and is going up regularly. So we're seeing some cities show the highest counts they've had yet. This summer, where we thought the heat would bring some safety, isn't turning out to be the case. In fact, a lot of the states that are hotter, the states that use air conditioners, are seeing spikes in their cases as we speak, Mika.
Willie.
Hey, Dr. Gupta, it's Willie. Good to have you on this morning. Obviously, the country has averted its eyes to another issue for the last couple of weeks, rightly so. But you, as a doctor, as a public health expert, have not been averting your eyes. You've been watching exactly what's going on with coronavirus, what continues to happen. So where are we right now? I think psychologically, a lot of people think that we've sort of turned a corner here and it may be safe to kind of go back out and resume our lives this summer. But how do you put it? Where are we right now?
Well, always good to see you. You know, what I would say here is you flashed the Surgeon General's comments. I'm not sure where he's getting his data. And maybe he's getting it from the president or the vice president, but certainly not Dr. Fauci or Dr. Birx, because the curve isn't flattening in 22 states at least. Certainly globally, we're seeing very alarming findings not far from us, Brazil, Mexico, not super far from us, even out in Europe and places, Africa and Asia. So we should be concerned about the global landscape because, one, that means that fall wave is probably going to be an August wave. And right now what's happening is, are we actually in phase 2 of the first wave? Doesn't seem like it really went away. And unlike March, when there was an appetite to say, okay, we'll yield to intrusive measures on our lives, we'll not go to work. I mean, and the economic catastrophe that incurred, we don't have that runway anymore. We don't have the ability to say, you got to stay home or you got to mask. Governor Kemp in Georgia basically saying no more masking in restaurants made no sense. Dr. Campbell's point, temperatures is not going to bring a reprieve. And I think most alarming, I'm about to go into a shift in the ICU. Arizona ICUs are completely packed. That to us is what's very worrisome here. And you add protests, you add people's Willie, as you said, lack of appetite to comply with masking anymore. People are getting tired. This is very alarming. So we're very much not flattening the curve. The curve is re-expanding, and we just need to talk openly about it. And the Surgeon General should be at the tip of that spear, not try to convince us that all is well.
So the curve is expanding, as you say. It's not flattening across the country. It's been flattened in some of the hot spots like New York City, which got so much of the attention in the early days and weeks of this crisis. So what do we do now? We've talked about testing for 3 months. Testing. That talk has sort of subsided as if testing is readily available to everyone who wants it. Is testing still the most important part of this story, Dr. Gupta, and where are we on testing?
It's always going to be important, Willie, and that's just a fact of life in a pandemic. But I think there's two things that we could potentially do up front. Three things, rather. I don't think this is ever going to happen at this point, but we need the president and the vice president to not undermine, be adversaries of the public health world. You have the president about to have a super spreader event in Tulsa. The fact that he's asking for informed consent of his supporters before a rally where there's going to be no social distancing or masking is egregious. That's what I do before I do a procedure in the ICU, because I know there might be harm, but there's potential benefit. What's the benefit to these supporters other than giving applause to the president? It makes no sense. We need to stop that. We need to ban political rallies. We need to encourage masking and, frankly, make it mandatory. I've been saying that for weeks. And contact tracing. I'm worried about the ability to scale contact tracing because that requires public trust. It requires people to say, I believe in our public institutions and our elected leadership. If you don't have it, it doesn't matter if it's an app or a human being, no one's going to assent to it. So really, those are the three things I would say we need to really focus our attention on. That requires high-level leadership.
I want to extend this question to Dr. Dave because I know he has the same concerns Dr. Gupta has, but there are also political protests taking place around the country, and a lot of health officials have expressed concern that the coronavirus can be spread among those protests. So, Dr. Dave, what should people do if they want to participate in these protests or go to a rally to protect themselves? Is it possible?
It is somewhat possible. I think the first thing that they should do is think seriously and hard about whether they should go or not. Think about whether they have someone at home that's older, that has an underlying health condition. Think about whether they're a healthcare worker that has to go back to a clinical area and may have been exposed during a protest or a rally or at a theme park. Theme parks are opening up in Florida. So the first thing to do, in my opinion, is think really hard about what you're about to do and weigh, as Dr. Gupta said, the risk versus the benefit. And then if you go, wear a mask, don't share your water, don't share your food, try to socially distance. Dr. Nguyen had told us how you could make these little buddy groups where you have several protesters or friends or family that you're hanging out with anyhow, and stick together and try to isolate from others around you as much as possible. 6 feet does not seem to be existing in a protest. And when you're all done with your protest or your theme park or the rally for President Trump, go get tested. Get tested so you can know whether you have converted to being positive for the coronavirus so you don't then spread it to others at home or at work or around you, Mika.
Doctors Vin Gupta and Dr. Dave Campbell, thank you both very much for being on this morning.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.